Hello, everybody. Welcome to our event for the Transforming Communities, a Movement to Racial Justice. We are featuring today the 2021 Silicon Valley Pain Index, authored by Dr. Scott Myers-Lipton. My name is Jamel Williams. I am the Director of Advocacy for Racial Justice in the Community and Government Relations, the Office of the President here at San Jose State. And I'm excited to be a part of the panel. I'm excited to be working with Dr. Myers-Lipton, and I look forward to the conversation we can spark today. So, Scott, you want to take it on from here, sir?
So thanks all for participating in this really important discussion. We have some amazing community folks on. We also have Dr. Bill Armerline on, who is the director, as many of you know, of the very important Human Rights Institute, which publishes the Silicon Valley Pain Index. So maybe we could have Bill just jump on and say a few words about why, a little bit about the Human Rights Institute, and then why they decided to publish this yearly, this report.
Hey, Scott, Jamal, and everyone. First of all, I want to say thanks to our audience for joining us today. I want to say thanks to Jamal and my colleagues for the Transforming Communities series and for having us as an institute in several of these events throughout these 2 weeks. And I'm really happy to be here to talk a little bit about the Silicon Valley Pain Index. As Scott mentioned, this is an annual report that we are putting out now as an institute. Our first was in 2020. And this report is really first meant as a measure, a public measure that everyone can see and that our policymakers can use as a guidepost for Santa Clara County, since Santa Clara County declared itself a human rights county in 2018. And so one of the reasons we started this Silicon Valley Pain Index is to sort of, again, provide a public measure of sort of how we're doing when it comes to these human rights measures. It looks primarily at issues of discrimination. So the Pain Index looks primarily at larger issues of discrimination, but also issues of structured inequality. This isn't just because these are some things that tend to define our region, but it's also because these are some of the fundamental aspects of international human rights law. You'll note that in all of our major human rights instruments, all of them include an anti-discriminatory clause, and sort of these sort of notions against institutional forms of discrimination are central to human rights instruments in international law in general. The Silicon Valley Pain Index is also meant to educate and not to prescribe. And so again, the role for us as an institute and the role for the index is to educate our community, our policymakers, our stakeholders, our community organizations, our educational institutions on the status of our community when it comes to some of these many measures that my fellow panelists will discuss today. And so what do we do with the Silicon Valley Pain Index? Well, as I said, we mean it to be informative, to be educational. And then as the process typically goes, and as we hope it continues to go, community members and policymakers then approach us as an institute, and we start working on what we call SVPI inspired campaigns. And so we're then around to sort of inform the conversations and solutions that folks want to put forward to hopefully address some of the problems and the pains that we describe in the index. As Dr. Myers-Lipton will also, I'm sure, discuss, the Pain Index actually has a history. There are some other folks that did similar projects before that we've sort of based the index on. I'll also say that the 2021 index was really largely inspired by this sort of second round of Black Lives Matter rebellions that occurred in the summer of 2020. And the results that we find are quite startling. And they're startling in the ways that many of our other data seem to be throughout this period, where we see that COVID and the effects of the pandemic have included exacerbating many of these structured inequalities that we see across our communities. And so what are some things that we're going to be working on now, thanks to the Silicon Valley Pain Index as a sort of starting point for these discussions in 2021? First, we're working with the Santa Clara County Human Rights Commission, and we're working with the SEC HRC on a few things, actually, more than we can actually talk about today, but I'll just hit a couple. One is to try and make sure that from this point forward, or whenever it's proposed, that the Santa Clara County Board of Supervisors will have to list the quote human rights impact of new policies and actions that come in front of the board. Secondly, we're talking about all kinds of other issue area recommendations to the Board of Supervisors, and our local HRC has now divided up into issue area groups, housing and other kinds of issues that confront us as a community. And we'll be working to inform those working groups and putting forward recommendations to the board for policies and actions. Second, we're working on AB 1400 or CalCare with some of our partners in policy, Assemblymember Kalra, Senator Dave Cortese, Assemblymember Lee, and many others that we've worked with in some of these campaigns. And we see this as really central, particularly given the inequalities and impacts disparate that we see coming out of the pandemic. And so jumping on top of CalCare as an opportunity to provide universal health care in California is a huge opportunity that springs from this. And then lastly, Scott and I are working with several different policymakers on other ideas that include a UBI for students and foster youth, and also some revenue generating possibilities like coming back to an oil extraction tax discussion that also links to climate change, or other sorts of issues like a gross receipts tax rather. Because one of the things you're going to note in the Silicon Valley Pain Index that I really should have mentioned earlier is that in addition to this sort of like exacerbating inequality and discrimination that we see throughout the COVID-19 pandemic, we also see a just absolutely drastic rise in revenue, wealth, and concentration of wealth among the owning class and their corporations in the region, where before we were breaking records with the first $1 trillion companies, now these companies have broken records again at market values of over $2 trillion. So with that, I am going to turn it back over to our report author, Dr. Scott Myers-Lipton, also my colleague on the Human Rights Institute Human Rights Working Group. And as I make my exit, I'm also going to include our website in the chat for any of you that wants to check out more on this project or any other projects to the Institute. Take it away, Scott.
Thanks so much, Bill. So I wanted to go back to, what Bill said about the creation of the pain index. So the murder of George Floyd happened in late May of 2 years ago now. And that was, the response in San Jose and throughout the world was obviously, a powerful experience for all of us. And what I, as a sociologist, came to believe is I questioned what could I do as a response with the knowledge base that I have. What could I possibly do to respond to the murder of George Floyd and to Ahmaud Arbery and Breonna Taylor and so many others? And so what I decided to put forward, and I talked to Bill, is I had an idea in my head for maybe 10 years to put out a pain index that would be based on race and class and how they play out right here in Silicon Valley. And it was based on the idea that came out of Katrina and the post-Katrina work. There was a professor there who created a Katrina index, a pain index. And so I asked Bill, I said, would you be willing, if the Human Rights Institute, to publish it? And he said yes. And so then it was a 24/7 for over 4 weeks, working with Bill to come up with the first pain index of 2020. So as Bill said, the goal of the pain index is, the first one is to raise awareness among community residents. We want people to know about what's going on here in Silicon Valley, but we also want to create a baseline for policymakers. So every year that we do this pain index, starting in 2020, we have now a baseline from 2020. We did 2021, we'll do 2022 in June, and say, is there less pain or more pain when it comes to wealth and income inequality here in Silicon Valley? And the hope is that it'll lead to policy change, that the city councils, the supervisors, the lawmakers, the Congress members and state legislators will drive policy change to address the pain within our community, particularly if it's getting worse or not getting better. We want to see policies that are addressing that. And the last one is that we hope, maybe it's a hope of hope, that other counties would consider doing pain indexes, because we think it's a great way to have community participation, in our political process. So let me just say, two things about the general structure of the pain index. This last one has 60 of the most recent studies and reports that have been conducted on Silicon Valley. and with composed of 90 statistics. And they're laid out from 0 to 2 trillion. So they're put in a pretty provocative way, and it's designed to be read from start to finish. And as you go through the numbers, the inequality is dramatized. So let me just say a few things about some of the key findings of the report. So the 2021 pain index shows that most pain indicators have worsened from the previous year, from 2020, as it relates to hunger, housing insecurity, homelessness, high school dropout rates, as well as income and wealth inequality, all in the wrong direction and creating more pain. So let me just provide a few examples for you. First, and for example, is food insecurity, since it has increased fourfold during the pandemic, with Second Harvest Silicon Valley providing groceries for 500,000 clients each month. So take that into 500,000 clients in Silicon Valley needing groceries to survive. That's a fourfold increase since the pandemic started. Households facing the risk of eviction increased over 15-fold, up to 997,000 from 12,000. The homeless or houseless population increased over 11,000 up to 11,500, up 9% from the previous year. And the number of homeless people that died on our streets increased 22%, up to 197 folks. High school dropout rates, just within 1 year. So that, the title of it was, it went from bad to worse, bad to outrageous. The high school dropout rates increased 14% just in 1 year, from 8.9% from the previous year to up to 14%, with the largest increases in houseless, homeless students, and ESL and Latinx students. But it wasn't bad for everybody. That's the key part for you also to understand. It wasn't bad for everybody. Since the publication of the 2020 Silicon Valley Pain Index, the top 10 Silicon Valley moguls, all white men, by the way, they've increased their net worth from $248 billion to $571 billion. That's an increase of 130% in 1 year. Meanwhile, for other folks, for African-American folks, their income decreased during that time period by 1% to about $40,000, and Latinx community increased just a little bit, 5% to $30,000. So here we have the people in the middle, or the working class, stagnant or going down, and the top 10% or the top 10 moguls just flying through the roof. So know that happened, and that's just in 1 year. Finally, all aspects of COVID-19, and I'm referring to the reported cases, the death rates, the vaccination rates, they all show how race and class are privileging some, the white and the wealthy communities, and harming others, the working class and people of color. Just give you one example. When the report came out, 93% of Los Altos residents, a city within our county, in Santa Clara County, a predominantly white and wealthy community, had a vaccination rate of 93%, compared to 66% on the East Side community, which had been mostly Latinx and working class. They had one of the highest death rates compared to the Los Altos community, which had very few deaths. So you see it even in how COVID's playing out. Let me just say one thing about the long-term structural issues that have been going on and not just impacted by the pandemic. And the 2020 highlighted this, but it continues in the 2021. And this is in light of promises from the Silicon Valley firms that they're going to change, but there has been such little change. Give you some examples from 2021. One Black person is on Apple's executive and senior management, or out of several hundred. 2% of Google employees are Latinx. If you continue down, 3.9% of Facebook employees are African American, with only 4 Native Americans out of 4,000 plus executives, VPs, and managers, only 4 Native Americans, and only 5 Black executives at Cisco out of 285. So I'd just like to conclude back to where we started, which was the murder of George Floyd. Here in San Jose, over the past 5 years, not one San Jose police officer has been prosecuted for killing someone, despite 19 fatal encounters with the police, 15 of which were with people of color. That ranks San Jose #1 in the Bay Area for fatal encounters with the police. So it's not just happening out in the larger America. Right here, there are fatal encounters and no prosecutions. So I'll end there and just say that I look forward to hearing from our community experts about the Silicon Valley Pain Index, how it's playing out. And I'll put up a link. I think Bill put it up, but I'll put up a direct link if he didn't do that. But I want to introduce now, I'd like to introduce Jamel. And you already know Jamel, but Jamel is going to talk about how the pain index, his perspective of the Silicon Valley Pain Index from his view. So Jamel.
What's good, everybody? I'm back. Thank you all for listening. And I have to first say that I really do appreciate this pain index. I like the way Scott laid out the information. I think it's very easy to read. I think it's very palatable when you see the numbers and the description and you connect those pieces to what you see happening in Silicon Valley. And I believe that the title, right, pain index, it really describes what's happening. One thing I want to touch on is this idea that these numbers they're not just words you see on a page. They're not just figures you see on a page, right? They're not just, something that the data shows and you're reading and you see words, you see numbers, and it's something you can't tangibly grab. I want you to imagine and envision what you're reading in this pain index as each one of these data points is connected to a human, right? It's connected to a person. It's connected to a life. It's connected to an existence in this area. And when you think about it that way, you realize that what you're reading is not just data. You are putting yourself in the lives and in the space of the lives of our community members. You are seeing these outlandish numbers of wealth from some community members and these exorbitant numbers of stark inequality and despair from others. So when you look at it that way, you can imagine what it feels like when you're on the negative end of this data, when you're a life, when you're a family, when you're a resident on the negative end of this data. It is pain. That is the story of pain in our community. And these aren't just people, right? These are our neighbors. These are our friends. These are the people who make up our neighborhood, the people who make up our teams, our schools, right? These are the people we shop next to. We're on the VTA with. We see them biking down the street. We see them walking, right? We see them living in tents and under the overpasses, right? So we got to look at this data in a way that that tells a story and that connects to human lives. I do work at San Jose State, but one of my other roles in the community is to co-chair the Black Leadership Kitchen Cabinet of Silicon Valley. And we advocate and fight for Black people in this area. We fight to help make the lives of Black residents better and the conditions better for us, and to help get our community in a place where we're thriving and not just surviving in the area. And a couple numbers on this pain index really stand out to me. The 172,000 people who have zero or negative assets or no savings. And then the 197,050 people who face risk of eviction or mortgage non-payment, which is up from 12,000 people in 2018, right? So we've jumped the shark in terms of the number of people who are risking losing their housing. And as a Black resident out here, some of the data that I think about is we're only 3% of Santa Clara County, but we're 20% of the unhoused population in Santa Clara County. And if you go up, right, so we think of Silicon Valley of having an impact down here in the South Bay, being part of the South Bay, but what we know is what's happening in Silicon Valley is impacting all of the Bay Area. And we don't have to look any further than Oakland to see how housing disparity has really cut deeply across racial lines. Once a thriving area for Black people. We look at Oakland now and we see that 70% of the unhoused population, 70% in Oakland, the Black population is I think in the 20s, but 70% of the unhoused population in Oakland are Black people, and 44% total in Alameda County, right? So like nowhere in this entire state can you find a city or a town with 70% being Black people, unless you're on the streets of Oakland and looking for people that don't have housing, right? Think about what that's saying, and then juxtapose that with this idea that Apple's market value is $2 trillion, right?
Mm-hmm.
So what is all this saying? What this is saying is that we have dug ourselves into a problem, right? And these numbers highlight that problem. They illuminate that issue, and we see it as we walk down the streets here in San Jose, as we talk to city council members and county supervisors about how to protect, how to care for the Black residents. And this isn't just an issue for Black people. That's just the coalition that I work with. Those are the lives that we fight for. But we recognize that all of these data points cut across ethnic lines in many ways. So what we're saying is that we've seen this problem continue to be created over decades, right? Decades of capitalism run amok, right? Without any kind of safety nets to protect vulnerable citizens, and in no system to atone for the ways that Black, brown, and indigenous and Asian voices have been, and Asian lives and voices have been excluded from being able to participate in this economy. See, we can't just start with today and say, now there are rights for everybody, go live and be happy and thrive, because we've seen from the apology of the Chinese Exclusion Act to how, when the city of San Jose talked about how the history of segregation, we've seen systemic ways that Black, brown, and Asian and indigenous lives have been cut out of being able to gain opportunity, being able to purchase the land that they once had, right? Being able to set up their businesses and really build a thriving neighborhood and a thriving community. So now we end up here, right, with just all types of stupid disparities. And what this pain index tells me, as Scott said, he hopes this is a call for new policy, new changes, is that without bold, drastic solutions, we won't see these numbers change. When you talk about 4 indigenous executives in Silicon Valley, and 1 person here and 2 people there and 3 people in this space, and it's not going to change from some diversity program that Intel or Cisco or any of these big tech companies decide to create. It's not gonna change by saying we got to get more BIPOC kids into college. That's not how you change what we're looking at right now. There has to be a drastic shift in how we rethink housing, how we rethink our spaces, how we rethink our resources. So I applaud everybody, right? I am kind of, my role was created due to the rebellion that Dr. Armeline talked about last year, to help San Jose State think about how we engage in racial justice work. And you can see over my shoulder the title of the event that we created. But even these positions that we're creating for people aren't enough, right? We have to go further. We have to think bolder. And I'm excited that Dr. Myers-Lipton put this together to help everybody think towards that direction. And I just want you all to remember, these are lives and not just numbers, they're lives. And if we care about our lives, our neighbors, and our community, we're gonna continue to push for bold strategies and solutions. Thank you, Scott.
Thank you so much. So next is, and by the way, so powerful, Jamal. Thank you so much for that. Is Darci Green, she's executive director from Latinas Contra Cancer. So we're really honored to have you, Darci. Thank you for speaking.
Thank you for inviting me and for continuing to push out the Silicon Valley Pain Index, which I think is such an important document. It's actually a document that we've been using in our new curriculum around our Defensoras effort. We've recently launched a patient organizing effort where we are organizing Latina patients to make changes within the healthcare system, to look at systems change. And we absolutely use the Silicon Valley Pain Index. One moment. I'm a single mom working from home.
Mommy, if you give me your phone, I'll give you.
Okay. So how we use this pain index to train our defensoras to understand how these different systems overlap. At Latinas Contra Cancer, we serve the low-income Latino community around issues of cancer and health access. And we can say that the numbers that we're seeing here in this pain index and the really startling data points that we're seeing, we see play out every day in the client base that we serve. We're seeing medically vulnerable people, caregivers, whole household, single moms, children struggling to get their basic needs met. Frankly, as an organization, we've grown accustomed to the idea that the medically vulnerable lose housing, jobs, ability to feed themselves, care for themselves because of the type of economic structure that we have in place here in the Valley and here in the country. This existed prior to the pandemic, but the pandemic definitely worsened and deepened this injustice and disparity, where we have people facing urgent risk of homelessness, people facing urgent food scarcity issues, people really living day to day, trying to figure out how they're going to cover their medical costs while paying their insurance premiums, while taking care of loved ones, while trying to find work, while trying to get just basic needs covered. This persistence of social and economic inequality as outlined in the Silicon Valley Pain Index is particularly unacceptable because it is predictable and therefore preventable. It certainly was not a surprise to anyone which communities would have been disproportionately impacted by a public health crisis or a public pandemic. We see this same mirroring demographic impact in chronic conditions. We see this in cancer as well, that low-income communities, communities of color, Black and Brown communities specifically, are disproportionately impacted socially in their health outcomes and then economic outcomes because of these chronic conditions and because of the way that these systems overlap. In this pain index, we can see in data how these systems we have in Silicon Valley, if you look at housing or education or healthcare, many of these different systems and institutions that we depend on to live, policing, government, how these systems have overlapped over time and certainly deepened from the pandemic to intersect to create this kind of web of oppression, right? All of these things kind of compounding on each other to make a insurmountable hill of things that people have to climb. This pain index shows very clearly who has this proximity to power, right? And if you are unhoused, if you are undocumented, if you are not English speaking, if you are there's many different identities that come into play when we think about our proximity to power or our proximity to marginalization. And this pain index shows very clearly on paper and with data what many organizations like ours are seeing every day in the client base that we serve. I think that I know that Jamal and Will spoke earlier about this catalyst, and so did Dr. Myers-Lipton, around the catalyst being George Floyd and Black Lives Matter and all of the organizing that happened during that year, but really over years and years of organizing and activism happening on the ground. And I think that's really fitting that it would be a catalyst for continue or increase conversation around this topic, because when I look at this pain index and I think about the clients and the real lives, as Jamel spoke to, that who we are serving at LCC, I can't help but think about the Black feminist framework of intersectionality and how you can't just piece out, and again, speaking to what Jamel said about like these small Band-Aid solutions versus the sweeping systems change that we need in order to solve these issues. You can't really look at any one of these oppressive forms or any one of these individual data points in isolation of each other, right? They all are overlapping and intersecting to continue to bring forward this type of violence onto communities in our valley. And really, when you think about it, when these systems combine and overlap and intersect to continue to marginalize the communities that are called out on this, or that have data written up for them on this pain index, it's really also an effort to maintain power for those who hoard wealth in this valley, power for those who hoard wealth and those who take advantage of the privilege that these systems afford them. And you are seeing this very clearly right now happening in our current housing fight. And there are so many people who we might refer to as NIMBYs, right? Who are organizing and are mobilizing and saying ugly, awful things about people in our community, about our neighbors, about us, in an effort to stop progress, in an effort to stop humanity, common humanity for fellow people, in an effort to stop progress on doing something about the data points that we see here in this pain index. And it is all about power and maintaining that status quo. And so I really appreciate that this pain index exists, and that the narratives and stories that CBOs like ours are seeing on the ground every day are painted very clearly in Black and white on a report that people can look at with data behind it. And the call to action that I would have, in addition to reading about this pain index, familiarizing yourself with it, I hope I never stop being disgusted and shocked by the things that are in this pain index, even though we have seen them happen over the years and we're used to seeing this on a daily basis. I hope I continue to always stay as disgusted and shocked as I am every time I read it. But the call to action would be to get involved in some of these fights, to make sure that we're saying yes to housing developments that are going to expand housing opportunities for people, to make sure that we're saying yes to expanded programs and social services, to make sure that we're saying yes to building more just and equitable societies for us all, to make sure that we're saying yes to reimagining public safety, and to moving forward these tenets of social justice and public health, frankly. So with that, I will conclude and just thank you for inviting us to be a part of this panel today and to share a little bit of the narrative that we're seeing on the ground with the clients that we're serving and the connection that we feel that this has to the work. Thank you.
Thank you so much for that, Darci. And I couldn't agree more. The intersectionality lens is going to be critical if we're going to solve these issues that are going on, these pattern structural issues. So thank you so much, Darci. Our last speaker is Reverend Steve Pinkston. He's a reverend, associate pastor at Marantha Christian Center, but I knew him as a teacher at Bellarmine College Prep. And he's a wonderful man. And importantly, I just read this as I was reading some information about you, Reverend Steve, is the first African-American teacher at Bellarmine College Prep. And that's, that says something, so much about your life story, but also to the issues of today, we're talking about how race and class play out. So welcome, Reverend Steve. So happy to have you.
Thank you so much, Professor Scott. Good afternoon, everyone. Thank you goes to the previous speakers, Jamel Williams and Darci Green, Dr. Bill and Dr. Scott. Actually, comments that you have made me shift a little bit my talk. Darci, you were talking about housing, and the need for housing in this valley. I know in San Jose, there are close to 9,000 people who are houseless, unhoused, and that is an atrocity in a valley where there are thousands of millionaires who exist here. Just 2 weeks ago, I attended a community meeting in South San Jose. There is a school where my son actually went to kindergarten, Glider Elementary School, that was closed 5 years ago. And since that time, the school district has said, we want to sell that property. And there has been a developer looking to purchase that property. The community meeting of neighbors basically gathered to say, we don't want those people moving into our neighborhood. And I questioned, who are those people that you're talking about? And some said, not all, but some said, those people are teachers. Why do we want teachers to have, for us to provide low-income housing for teachers? They said, we don't want those people coming down from Oakland, those people coming down from Richmond, living in our neighborhood. And I spoke up and I said, you know, I've been living in this neighborhood for 34 years, and I am a teacher. Fortunately, when I purchased my house, it was only $160,000. I say only, but I was able because I had some assistance from my father. I grew up and went to high school in Richmond. So when you say we don't want those people from Richmond, those teachers, you're talking about me. Are you really saying you don't want people who look like me coming into this neighborhood? But I've been here 34 years. It takes me back 100 years when the start of the Great Migration was happening in this country. Some of you may be familiar with it. Between 1915 and 1970, millions of Black people fled the South, leaving because of Jim Crow, leaving because of lynching, leaving because of the Ku Klux Klan, leaving because of disdaining forms of prejudice and racism. I think of my great grandmother, my father's maternal grandmother, who lived in Tallahassee, Florida, 100 years ago today, in 1921. She was a businesswoman. She was a seamstress, had a thriving business. She owned her own home. She owned her own horse and buggy. She was prosperous. But the Ku Klux Klan back then was jealous of her, and they burned her house to the ground. And after they burned her house to the ground, my grandmother couldn't turn to any insurance agencies. My grandmother could not collect any funds because of the losses that she incurred. But she, as well as my grandmother and grandfather, fled the South, fled Florida, Tallahassee, Florida, going to the east for, going to the Northeast for better opportunities. Not only did they leave, but my maternal grandparents left the South, South Carolina. My wife's grandparents on the paternal side, they left Louisiana, going north, actually northwest. My wife's maternal grandparents left Texas, going west for better opportunities. I think Richard Wright penned it well when he penned the poem, The Warmth of Other Suns. He said, I was leaving the South to fling myself into the unknown. I was taking a part of the South to transplant in alien soil, to see if I could grow differently, if I could drink of new cool rains, bend in strange winds, respond to the warmth of other sons, and perhaps bloom. Leaving the South for new opportunities. How many people in Silicon Valley are here today looking for opportunities, looking for a chance to prosper, looking for a chance to thrive, looking for a chance to have their families get educated for themselves to be thriving in this area? The pain index penned by Dr. Armelene and Dr. Scott Myers-Lipton points to the fact of the discrepancy, of the disparity that exists in our valley here in San Jose. I'm not talking about happening in other counties and other states and other countries, but here in our home area. The disparities are atrocious. The disparities are sickening. The disparities must be, should be, have to be corrected. I am clergy. I look at scripture for guidance. I look at scripture for direction. In 2 Corinthians chapter 8, verses 13, 14, and 15, Apostle Paul speaks to the inequity that existed 2,000 years ago, and I dare say that exists today. He says, I don't mean that you should give so much that you suffer from having too little. I only mean that there should be some equity. Right now, you have plenty and can help them. Then at another time, they can share with you when you need it. In this way, everyone's needs will be met. Do you remember that the scripture said, what the scripture said about this? Those who gathered a lot had nothing left over, and those who gathered only a little had enough. My plea, my challenge to all is that we can all have enough. I don't want to have all that money that when I die, it just is there. It's not benefiting anyone. But I want to have enough now, and I want my neighbor, whether that neighbor is in East San Jose or West San Jose or North or South San Jose, whether that neighbor is in Mountain View or in Campbell, I want my neighbors to have enough. That's my plea, that's my call, that's my cry. Lastly, we'll conclude with a verse of scripture penned by the prophet Micah in Hebrew scripture. Micah in chapter 6, verse 8, asks, I dare say, the rhetorical question, what does the Lord require of you? And the answer is quite simple. The answer is to love justly. What is justice? That we can all have enough, that we can all thrive, that we can all exist and do well. What does the Lord require from you? That we all engage in justice, that we love mercy, and that we walk humbly with our God. I challenge you, do justice. I challenge you, be merciful. I challenge you to walk humbly in this life. Thank you and blessings to you all.
Thank you, Reverend Steve, for those words. And I'm always so taken when you speak. So thank you very, very much. So now is the time to I don't know, Jamel, if you have access to the questions, or if people have questions, I would, whether from me as the author or of the panelists who have spoken so powerfully today, that would be wonderful to hear from folks.
So right now, Scott, we don't have any questions.
I think
So
Ingrid had their hand raised, but I'm not sure if she's still on or not. Ingrid, are you there? And if not, all good.
I did have my hand raised. Though I did not do it intentionally, but I was thinking a question, so maybe it was intentional. I heard you say some numbers about homelessness up to like 11,000, and I think I missed when you were kind of talking about that information. I was wondering how the information was gathered, or like what area that covered.
Yeah, I think it's Santa Clara County. So if you look at the full report, after every data point given, there below it has the citation from the study or the report where it came from. So if you go to that, you can see all 90 plus stats where they had been attained from. And really mine is not so much that I didn't do the research, what I did was to do a meta-analysis of all the research being done on Silicon Valley. And from what the community such as yourselves who are working at Destination Home has said, is that actually is an underestimation. That 11,500 is that when the numbers get done again, that number will be much higher than that. And so that's probably an underestimate of the true number.
Yeah, thank you. I'll definitely check it out. I haven't been able to read the full report. And I just wanted to thank all the panelists. I know all the work that they're doing, including yourself, and just it's amazing work to see the community just come together like this and what's being done. It's really inspirational to me. So I just wanted to say thank you to everyone on here.
Thank you.
Scott, if I can add also, I'm sure Ingrid is very well aware of the point in time count that is mandated by the federal government for all counties that receive federal funds. The last point in time count was done in 2019. COVID prevented it from happening in 2021, but that point in time count talked about the homelessness specifically, the number of people that were unhoused in San Jose and in the county of Santa Clara. A challenge that's faced by advocates for housing people is the fact that for every person that is able to secure housing today, every person that is housed by organizations like Destination Home, and that there are 2 people that become homeless. I mean, it's a tragedy. You get 5 people housed and 10 people become unhoused due to the economic challenges that exist in this valley. It's a harshness that too many people are incurring today.
And I just wanted to add that something's going on at San Jose State. If people aren't aware, SJSU Cares just did release their report of San Jose State homelessness, of how many students experience homelessness at least one day. And they found 11% of our students, when they sent out a survey to all 36,000 students, and that study shows 11% experiencing homelessness. And if you do extrapolate the numbers, that's 4,000 of our students. So just what you see, Jamel, next time, and Bill, when we're walking out on our campus, every 11th student we see, that means that one of them is going to experience homelessness sometime throughout the year. And to me, that is a crisis of epic proportions. What can we do regionally in Santa Clara, but also statewide, working with Representative Oshkar and Senator Cortese to really address this statewide issue as well. Because if you extrapolate out to the rest of the CSUs, the number is over 50,000 CSU students who will experience homelessness. How can you be a student when you are experiencing homelessness? Well, you can't, because your grades start suffering. I see it in my class all the time, 1 or 2 or 3 students who become homeless every semester. And it's outrageous in a space, by the way, where we have so much wealth in our community. It's just not
Exactly.
really right.
And I think that point about having so much wealth is what leads me to say that at this point, 2021, that the inequality and especially the homelessness that we see is a choice that we're making as a region, as a state. So absolutely. We have another question in the chat. It says, has the city of San Jose or local government responded to the Silicon Valley Pain Index?
That's a great question. So we, just so you know, as you know, we're a non-political human rights institute. We will talk to anyone, you know, liberal, conservative, you know, independent, anyone. So the one, I'll tell you the people we've talked to, Raul Perales reached out and connected and asked to meet with Bill and I. So we've met with them. And if any city council members hear that, or people running for mayor or any supervisors, we're willing to meet with anyone. But the Raul Perales did reach out to us, and we had an hour-long conversation. And he asked, like, what suggestions might you have? And so we brainstormed some ideas with him. And so, but he is one person that did reach out to us. And Senator Dave Cortese has as well at the state level. So we've had a conversation with him, as well as Congressman Khanna has reached out, and we've had a conversation with Representative Khanna, what could be done at the federal level. So there is interest in this. And I think for you who asked the question, is the right question is, you know, to ask our representatives at these various levels of what are you doing to address the pain index? I do want to say one other thing. The Human Rights Commission is putting forward an idea that all policies that are going to be looked at by the supervisors, they're contemplating putting forward an idea to them saying that they should consider the pain index when making those decisions on the county board of supervisors. So that's if that happens, that would be a positive too. And that's our hope, is that you know, the pain index gets used in this way to help drive policy.
Absolutely. It does not look like we have any other last questions. Scott, do you want to leave us with some last words? I as the originator of the event, the Transforming Communities event, I think this pain index highlights a ton of issues of racial injustice and areas for racial equity and justice that we all need to be pushing for and fighting for, and just continue to put pressure on our legislators, on the business people in the Valley, and really try to instill that everybody has, we all have the role to play, and some have an even bigger role that I don't think they're playing. They're not playing their part as well. So we got to continue to put pressure on that. So any last words you want to share?
I would just say with regards to right now, what we're trying to do is, like, we're trying to engage the political folks, but also the business community. The businesses have a huge role because they have so much of the wealth. And so they need to be engaged in a powerful way, as well as the policies they have on hiring and retention of folks of color. I mean, that is a huge issue, and the lack of access to senior level positions. So I think we're going to continue that work. We encourage anyone, you know, the Human Rights Institute is an open space. We're going to have these conversations. Welcome any of you to be involved in those with us. And we're going to be doing the 2022. You know, if anyone else is on the call, I've already actually talked to Ingrid. As you find the studies, please send them our way. We will include them in the 2022 Pain Index, which will come out in June for the third time. And we'll see how, you know, where are we in the year 2 of the pandemic? Are things have they stabilized? Are they getting worse or better? And hopefully the next Pain Index will answer some of those questions. So stay tuned and please stay engaged with us as we are working on this.
Awesome. Well, I look forward to 2022's edition. And I just want to again thank you for putting all this together, gathering this data, illuminating the stories of our community, and really kind of giving people a guide to what we need to work on. So thank you to Dr. Myers-Lipton, Dr. Armelane, Reverend Steve Pinkson, and Darci Green for you all's time and energy and efforts in this fight. And you know, we look forward to, 1, sharing this recording, and 2, seeing where we can move from here. Thank you all for joining us.
Thank you.